Hi, everybody. Thanks for stopping by, either live or on the recording. So, yes, a little bit about me. I've been a physical therapist for a real long time. In fact, actually, this month will be the 40th anniversary of my graduation from PT school. So I've been around for a while. And I've been in private practice since 1988, and I've been in this location on Orleans Street since like 2003, I think, something like that. So anyway, so today we're going to talk about neck and back care, ways to help you avoid aggravating a neck problem or causing a neck problem, and also some simple ways that you can help to reduce pain if you do have it, other than having to come and see me. But okay, so I'm going to start with anatomy first. I know it's kind of maybe a topic that might get some people snoring, but it's important. The more you know about how all the parts put together, the more you're going to understand why certain things happen and why if you do certain exercise it helps. So, okay, so we're anatomy. Just basically, cervical spine, your neck, is made up of 7 bones, and I do have a picture here. Okay. 7 bones. Starting at the top 2 vertebrae are very unique. We have atlas and axis. They are different than all the other vertebrae in that atlas is just a ring, basically, that sits right underneath the base of your skull. And then axis is also a ring, but it has like a little, they call it a tooth, that sticks up and it rotates the axis. Atlas rotates on the axis. It sticks up in the back. And so that's sometimes in high neck injury type things, you can actually break that little, it's like a tooth. They call it a dens. But anyway, so that's a real crucial area there for high cervical spine injuries. I know for like Special Olympics things, they, and I guess for certain individuals, Down syndrome people, I believe, they have a deformation of that dens, of that little part there. And every couple of years, they have to have a special x-ray to make sure that they're not at risk of injuring their neck, because a really severe injury there would basically paralyze them, if not kill them. So, okay, isn't that a cheerful way to start? Okay, so then after that, you've got 5 more vertebrae that are more or less standard as vertebrae go compared to the rest of the body here. It goes all the way down here to C7, that's the last one. And then after that, you start your thoracic vertebrae. Now, the upper couple, 2 or 3 thoracic vertebrae actually vary. They do behave a little bit like the neck, and a lot of times if they're stuck, if there's something arthritic change, or if there's a disc change or something like that, issues here can affect the rest of the cervical spine, even though those technically aren't part of that. A couple other things is that the biggest difference in the cervical spine compared to other vertebrae levels is that there is some holes along the transverse sides. You can see it right here, the red. Okay, that's the vertebral artery, and there's one on each side. And a severe injury to the cervical spine, to the neck, can cause issues and cut off blood supply. They go up to the brain. So in addition to the carotid arteries and things like that, they are part of the central nervous system circulation there. Okay, so between each vertebrae, kind of now going back to more normal things, there's a disc. It's kind of like a jelly donut in between each one that acts like a little shock absorber. And there's one between each vertebrae. Can't really see it here because of the vertebral artery, but there's one in between each vertebrae. And then you also have between each vertebrae, just immediately to the rear of that disc, you got your spinal cord that runs down the middle, and then you've got nerves that come off, peripheral nerves that come off at each level here. You can kind of see they're like that little yellow tinge there. That's the spinal nerves. Now those nerves all go down through the neck, and literally deep into the under part of your shoulder. They come out in your armpit, really, and all those nerves go to muscles and skin area. So it depends if they're motor muscles. or if they're sensory, like they go to the skin areas, they cover different areas of the arm. So injuries in this area, injuries or even just a compression of a nerve root can cause issues, either weakness or sensory issues into your arm. So it's not uncommon if somebody's got a bad enough neck issue to have symptoms into your arm and into your shoulder. And I'll get to that differential diagnosis of that in a little bit. But so a lot of times if you have, let's say, pain in your arm, we can go back to your neck. And so even though it might hurt in your arm, by working your neck, we can take away some of that pain by taking the pressure off the nerve. Now, there's two ways that a nerve can get compressed in the neck, and that's either by a bulge in the disc, or there are little joints that are on the sides. It kind of looks like, if you think of like a little tricycle, there's little joints on the side called facets, and they are like right there would be a facet joint. Anyway, they're between each one. And those are joints, they have cartilage and they have fluid just like your knee or your shoulder or any other joint that we have in our body. And so if you have arthritis of your neck, if that's one of your diagnoses that the doctor gives you by taking an x-ray, that's where the arthritis would be in the facet joints. You can have, if it's bad enough, that can also compress on the nerve root too. So, okay, so that's some basic things there. So also, you've got a lot of muscles that surround your vertebrae in your neck. Okay, you've got the extensors, the paraspinals that are in the back of your neck. Okay, you've got the platysmus, which is this big sheet muscle that's right in the front here. Okay, you also have, like, if they bulge out, they come from like right behind your ear, and they come down and across to your collarbone and to your breastbone there. That's called sternocleidomastoid. I know, long word. SCM for short. But anyway, so those are some of the major muscles in your neck. You also have a lot of thin muscles that are along on the side here, and those are called the scalene muscles. And sometimes you can have, if you've got spasms there, or if you have a neck problem, those muscles can actually pinch. Remember I said those nerves, they come off the vertebrae and they go down into your shoulder, the deep part of your shoulder, deep here. But they'll pass through those scalene muscles, and if you get tightness there, that can also be one of the causes for pain into your shoulder and into your arm, which is things that I diagnose and figure out. Okay, the neck also really has a lot of relations to other problems that you may not even think that are neck related. For example, headaches. If you have tight muscles in the back of your head, okay, there are paraspinals that connect the neck to the base of your skull. And then there's also a muscle that's right down on the back, low, really low, and that's called occipitalis. And then there's a big tendon that comes all the way from there, all the way up and across to the muscle that you can kind of, if you furrow your brow there, okay, frontalis. And if you have a neck problem, it can be literally a chain of events, to where you basically have muscle spasms in your neck, and that will translate over into the occipitalis, and then that's going to pull hard on the big tendon, the aponeurosis that goes across the top of your head, and it can literally pull hard on your frontalis muscle here, the one that's right here that you furrow your brow with, okay, and it can give you a tension headache. So just by changing your posture and improving that, you can literally get rid of a lot of headaches that people wind up having. The other area that neck problems can have issues with are your TMJ, your temporomandibular joints. And again, because of muscle attachments, if you have a forward head, which is probably one of the biggest postural faults of a neck issue, you're going to change the tension on those muscles, and that is going to change the position of your jaw, the TMJ, and then you can wind up having, you can have headaches from that. You can have chewing problems. You can have a click when you open your mouth, because the joint is all thrown out of position because of the way the cervical spine is positioned. So the neck really does have a lot of ulterior things going on there, that it's not just your neck. Okay, so like common injuries, obviously, like whiplash is one of the first ones that people kind of come up with. as an injury, to where, and what a whiplash is where your head is, you know, thrown forward very quickly and backward really quickly. And between all those vertebrae, you've got in addition to the muscles, you've got ligaments that hold everything together. And a whiplash is where some of those ligaments are actually torn, and so then your neck becomes a little unstable, besides being extremely painful. And so what you need to do for situations like that is, you know, they'll probably put you in some sort of collar to kind of let things heal up. Now, every now and then I'll see a neck patient will come in and they'll be wearing the collar for an extended period of time. You really don't want to wear it for an extended period of time. That's more for an acute problem like a whiplash or something like that, or any sort of injury like that. But you want to just get everything to calm down with that and then start weaning yourself off. Prolonged positioning with the cervical collar, and you can actually, and unfortunately don't have one here to show you, I can just describe it. Wearing it too long can make things tighten up, and then what you wind up having shortened muscles and some joint problems that then we have to work on getting them loosened up so you can move your head normally, so you can actually do some things like, you know, like checking the rear view mirror or the outside mirror in your car or something like that. So a cervical collar can be worn in two ways. All right, most people will have it, so you know how it's kind of it dips down like for your chin, and then the bottom kind of curves down low, so like that. Anyway, and then then the Velcro would go in the bottom. So putting it on that way with the Velcro in the back, okay, makes you it takes your head and kind of moves it back, forces it backward a little bit. Okay, which is fine if, you know, you've got posterior ligamentous issues or muscular issues that need to be relaxed there. But also sometimes you want to have the chin down because of a similar injury. So you turn it around and then the Velcro's in the front. So the back, the wider part kind of forces your head forward. And again, certain conditions indicate certain ways that you would wear like a cervical collar. But in any case, you don't want to get too attached to them. Use it when you need to, but then you start weaning it off pretty quickly. Okay, so that's like the major issue. But we can talk about like disc situations. People do herniate cervical spine discs somewhat, while it's not as common as a lumbar spine situation because of lifting and carrying and bad posture there. You can still have disc issues in the neck, to where the disc will actually bulge a little bit and push up against one of those nerves that come out in between there, those little yellow things there, and it can bulge out, put pressure on that, and then that can either kind of cause a very localized pain, or it can, or depending on how bad it is, can cause pain out away from the neck into the shoulder and into the arm. And depending on where your pain is in your arm will help determine what level the situation is at, because they all have different little territories that the nerves cover, and different muscle groups too. You can also have similar situation if you, like I mentioned before, with the facet joints. If you can have arthritis there, if the joint's swelled up or it had a little bone spur or something, that can also push against one of those cervical, the nerves there. Have issues that way. Okay, so any questions so far? Jane, Molly. I don't know who else is there. So far, Jane's is the only name on the screen. But, okay, so going on. So, all right, so you got the basic idea of the anatomy and things, and how just small changes put stress on certain areas. But the biggest thing with the neck is posture. In fact, it's really the big thing with any of the spinal levels, is trying to keep a good posture. Now, looking from the side, normally if you were like looking that way, your neck would have a nice, gentle curve. Actually, your lumbar spine has the exact same kind of curve. And that's all formed by the angle of the way the vertebrae are. Okay, so it makes it curve. And so if you're in good posture, in other words, so your head is kind of back, so your ears are over your shoulders more. Okay, so the weight of your head is borne more through the vertebrae than it is hanging on the ligaments and the muscles in your neck. Of course, that takes a lot of stress off of them. And so that will make things more comfortable. So the biggest thing that you want to do is try to get out of is when your head is forward like this, like it is when we're working on a computer, or I see, I don't know, and I see it more in women than I do in men, but if women that drive and they're driving, they got their hands on their steering wheel here, and they're looking like this. For whatever reason, that does put a lot of strain on your neck. It also, again, just like it's like a chain of events. If your head is here, your shoulders are going to be rounded, and the rest of your back kind of rolls forward, and it causes problems all the way down into your lower back. So literally, if you have bad enough neck posture, you can affect other areas of your spine too. So you want to, say we're sitting up, and even in a desk chair, even the chair like I'm in here right here. Okay, you want to get your head back over your shoulders and kind of lean back into the chair. Let the chair support you. If it's in a car, don't let it have the seat way back. Try to bring it up almost perfectly upright so that your whole body is supported, and including the headrest, so that your head can rest against that. That's going to aid in, first off, it's going to give your muscles a little bit of a break. They won't have to be working as hard, but it's also going to keep you in more proper alignment with and take the stress off of other soft tissue, namely discs and ligaments. So posture, again, keeping your head back, keeping your shoulder up straight. First, it looks a lot better. I mean, if your head's forward, your shoulders are going to go forward, and everybody starts to slouch. I mean, if you saw somebody at a meeting or something like that, and they're sitting like this, your regard for them is not going to be maybe quite as high. So you want to sit up nice and straight, shoulders not military, but just back of just a touch, your head more over your shoulder, and that's going to keep your neck in a better position. So okay, so there's that. So then we go through now our basic movements of the cervical spine to help reduce some of the issues with your neck. One of the things that you want to do, especially if you get the forward head, you want to do a movement called retraction. It's not something that we do really often, but it kind of looks like, let's see, hopefully this won't interfere with my voice too much, but okay, if your head is forward, retraction is bringing your head straight back, not looking up, that's a different movement, but just bringing it straight back. And just by working that movement gently, you're going to help to stretch out ligaments in the front of your neck to help allow your neck to go back that far. Also muscles, remember I talked about the platysmus here, muscles in your upper chest also, to help stretch those out so it allows your head to be positioned better over on top of your neck and over your shoulders. All right, so that's called retraction. And that's a really good exercise you can do. You can do that one, actually, you can do that driving, because you can stay looking, and you want to be looking straight ahead, and you can just go straight back like that. And you can do that at work. People look at you like you're kind of funny. It's like, what are you doing? And but you can still look at your computer and do retractions nice and easily. The other exercise that kind of goes on top of that is once you have all of that, okay, let's see. When do I wait? I gotta bring my glasses up here. Got a question here. Okay, when do I wait? Question. That's good. When I do the retraction exercise, something cracks in my neck, jawline each time. Is that normal? It's not necessarily normal, but it could be a byproduct. Cracking is because of a poor head position to begin with. So if you work it gradually, you never go crazy. Don't work it so hard to where you cause pain, but you want to work it gradually, stretch back further and further. You'll find that if you do a few repetitions, that cracking and popping will go away. And the fact that we talked about the TMJ before, the fact that you feel it into your jaw here, is again, you're changing the position of those muscles. They call muscles of mastication, chewing, that affect your TMJ joint. So just working nice and easy. You might feel maybe even a little crunchiness. I know I've been noticing lately, moving my head in further direction, more direction. I feel like a little grinding and things like that. Nothing to worry about, but that is that little crunchy. That's a little roughened cartilage, and but if you move it gently and you work it, gradually that'll go away. So something to be aware of. It's good that you are aware of it, but nothing to be panicking about. So, but just any exercise you want to do, you always want to start and work nice and gently. So we got retraction. Okay. So then the second half of that is extension. Now it's important to do, if you do extension without, you have to do retraction, then do extension, and they kind of combine together. Okay. Because if you try to extend, like if your head was forward, you try to tilt your head back, wouldn't get very far. Okay. But if you retract and then you extend, you can go a lot further. And I find when I've taught these classes at Midwestern University, their physical therapy program, when I do the cervical spine program there, I've done a while, is that women, for whatever reason, have extremely flexible necks, and you can get way back. But you always want to retract and then extend, because the retraction puts your head and your neck in the proper position to work from to begin with. So always want to retract and then extend. It actually is going to go, also relates to the next two exercises I'm going to do too. Get some water here, I'm drying out. Okay, so that's the basic, that's your most basic neck exercise is retraction, then retraction, extension. Some people will respond well to just a retraction, but when you try to get them to extend, sometimes it's a little difficult. Not unusual. It just takes practice and patience. So just keep after it. It'll gradually work itself out. And again, the reason it's maybe difficult is because maybe of some arthritis in the facet joints, maybe a bit of a bulge in a disc, or just tight muscles, and they need to get gradually stretched out because you've been used to doing this. And this also, when you're doing this, okay, it's protraction, but you're also flexing the cervical spine as well. And so, okay, it's the same question. Okay, so all right, so now let's say you have pain that is one-sided. Let's say it's just for whatever reason it's one-sided. We'll say that it's just my left side. Okay, so first line of defense will be just doing some retraction and just trying to get things lined up. And if that doesn't take care of it, then you can do rotation. Now, this is the way rotation and side bending. They both will take care of this condition, but they do it in slightly different ways. Okay, for rotation, okay, if we have pain on the left, you're going to gently retract, not hard, not way back, but just gently retract, and then you're going to rotate away from the pain. You're going to try to look over your in this case, my right shoulder. Okay, so retract and then and do that. So you may feel some tension and some muscles working. That's no problem. That exercises muscles working. But you want to watch and see what happens to your symptoms on the opposite side. So just gentle retract and rotate, and you want to gradually go further and further. It's not a race. Maybe hold it for a couple of seconds over here, and then gently bring it back, and then relax. So rotation. Okay, now the other one is side bending. Now for side bending, what you're going to do, you're going to also go, again, retract to get your neck in the right position, and then you're going to ear to a shoulder on the same side. Okay. Generally speaking, even those two motions do similar things as far as changing the pressure of the disc and opening the holes that the nerves come up. They're called foramen. Opening those up a little bit. People will usually be able to do one more successfully and more easily than the other. My experience is people usually do better with the rotations than with the side bend, but it may be different, and it could easily be the other way. So you've got those two exercises you can do as well. So you just kind of have to, a little experimentation and see how it feels. The big thing is though, it's like, okay, so why is your pain, let's say your pain is on your left side. So why is it there? If it just kind of gradually came up. So maybe it's one of your activities that you're doing, perhaps, and I talked about Molly's Workstation, and I'm trying to remember, I'm pretty sure her monitor's right in front, but I'll see a lot of times where I'll see somebody's at their computer and the monitor is going to be over here. So they're always like this, always, constantly. And, that kind of situation, is going to eventually wear on the joints, put pressure on again, the discs and the vertebrae and the muscles, and you can wind up having pain there. Another thing that you might see people with is, well, I think a lot more people are using, where you contactless, where you can just turn on speakerphones. I knew that was a word there. Okay, so you can use speakerphones and you can just talk out loud. But there are times, of course, you don't want everybody in the neighborhood hearing what you're saying. So you might just, put the phone up to your head. And if you wind up, or some people will try to hold the phone against like this. If you wind up doing that a lot while you're multitasking, doing something on the computer or something like that, that can also cause problems where, because when you shift like that, if my hands are two discs, to a vertebrae, when your foot is, your neck is always bent this way, you're literally pushing the disc more to the other side, and that can cause, while you think about it, you're thinking, well, it's going to pinch over here. Well, depending, yes, it could pinch the nerve over here on this side, but depending if it's a disc situation, you can actually be putting pressure on the nerve root on the opposite side. So like if I was holding my head like this, if the nuclear material inside of the disc, the jelly part of the jelly donut, was being forced to the other side, you could wind up getting nerve impingements on this case, my left side. So those are a couple things. So if you're at a desk, or if you spend a lot of time like in front of your computer and you answer the phone a lot and you're talking to people, it's worth but you can get wire tethered ones, you can get headsets. And then that way you can keep your head in a nice normal position and you can still speak on the phone without having to hold it like this. And that's gonna save, I can't figure out why if a boss has several secretaries or something like that. I mean, just by buying a headset for all the different people working, it's going to save a lot of neck problems. I mean, just taking a day off to go to the doctor or therapist or something to get your neck worked done or checked out. A headset is far less expensive than that, besides having the time off. So you can get them, of course, wired, or you can get them unwired. They're more expensive, but that way you can get up and walk around and talk too. So that is a big thing for neck issues like they're at a computer. The other thing is when you set up a workstation, you want it so that your eyes hit the top of the monitor, top of the screen. Okay, so that's where you want to be. You also want the keyboard to be actually fairly close to you so that you don't have to go reaching out with your arms to work on the keyboard, or even to get books and things like that, manuals and such. So if you're sitting nice and straight, head up, again, sitting back in your chair so the chair supports you completely, and you're sitting nice and straight. You got your keyboard right there, maybe mouse to, well, depending if you're right-handed or left-handed, mouse to the right or the left. And then, so things are closer, so you don't have to be straining like this. If you're straining like this a lot, perhaps it's you might need glasses or change your prescription for your glasses or something like that. But this way, if your screen is fairly close and you got the monitor or the keyboard right there, you're going to be able to see everything on the screen without straining your eyes. So that's a quick, just upper body ergonomics thing there. The other thing, just again, body mechanics, which is using posture with different activities, is trying to keep your head more over your shoulders. Sometimes you'll see people that have issues with walking, not necessarily older people, but sometimes with older people more so. They don't necessarily know where your feet are, and so that they'll wind up keeping their head down. Well, that's going to eventually cause enough strain in their neck to cause potentially nerve impingement problems there. So you want to try, your eyes move. So keep your head erect and look straight ahead with your eyes. That way you're going to see what's in front of you long before you get there. Because if you ever try and walk, and if you like just now, you just all tipped your head down, how far can you see in front of you? You're basically seeing like maybe a foot or two in front of you. And so if you're always walking like this, besides having problems with your neck, you're also not going to be able to see those barriers until you get right on top of them, and then you may not be able to adjust quickly enough to avoid tripping over them, something like that. The other thing is, again, head position being down. Your inner ear is set so that it knows that this is normal. And if you have your head down, it has to compensate balance-wise, and so it can be an issue with balance and falls too. So, especially if you already have a pre-existing inner ear condition, you know, keeping your head down and forward is not good for your inner ear. It's also not good for your neck either, because all that stress is going to cause more pain and problems. So I'm trying to think what else. Why don't we just take a moment for, and if there's any questions or anything like that, please throw them up there, and we can, sometimes that'll lead me in a different direction here, but let's see. Okay, so that's the same question there. So that pretty much rounds off a lot of the most basic stuff with the neck. Now, if there's specific problems, different kinds of treatment that you can have too, depending on, sometimes they'll do cervical traction. They have little units that you can hang on your door, and you can do that. And that's helpful. That helps to take some of the, it really doesn't distract the vertebrae so much. Is what it does is that just that little bit of tension will help to get the muscles to relax. And if you can get the muscles to relax, that's going to allow, again, you to move your head in with greater comfort and get back into a better position. As much as people might think that it's separating the vertebrae, it's not. It would take many, many, many pounds, well over 100 pounds. And by that time, if you've got 100 pounds of traction on your neck, you're going to be in a whole lot of pain because your muscles are going to be screaming. But yeah, traction is a nice thing. Obviously, a massage to help to relax muscles and things like that, that's fine. But the key thing is, let's say a massage, or let's say you have like an ultrasound, the deep heat ultrasound, not the ultrasound to where you get a visible picture, let's say on a woman that's pregnant, for example, you see the baby. It's not like that. It uses deep heat to create, it helps to relax the muscles. But ideally, when you do something like that, is to follow up with working some of the exercises. And now that your muscles are relaxed, working into doing a little more retraction, and maybe some more extension to where you can go back further and further. Ideally, when you full range of motion into extension is if you take the plane of your face and you tilt back, it's going to be parallel with a little like the floor. So it's actually going to wind up looking straight up at the ceiling to have full normal cervical spine extension. So if it's not going, if you're only going part way, then you've got a little bit further to go to get to normal range of motion. So let's see. Yeah, you want to keep it loose. You want to, and again, okay, posture. Getting back to posture, and with your head is forward now. Your shoulders are going to round forward, and once you start doing that, then you start affecting the next second down, the thoracic spine, and then eventually your lumbar spine. You're going to start to slouch. So, and you always want to kind of do a self-correct. Just come back, head over your shoulders, looking straight ahead, and trying to keep that. You'll feel it. You'll feel a lot of muscles working, and they are, because they're holding you up, because you're used to hanging on them here, because you want to be up here. Okay. All right. Any questions yet? Anything? Curiosity? Oh, wait, we got one here I got to read. After doing something with... Okay. All right. Chances are it all has to do with head position. Well, again, a lot of times when you bend forward, especially people are using bad posture and you're bending at the waist, so your head is going to go forward, your arm, and again, your shoulder blades are going to come forward, they're going to protract too, and that puts a lot of strain on the muscles in between your shoulder blades and things like that. And so what you want to do periodically, well, first off, you want to try and lift and carry, keeping your head up. You're going to find that if your head is up, your back is going to stay straighter when you squat down to pick up things instead of bending over at the waist. All right, so you're going to squat down. If you keep your head up, your back is going to be straighter, so everything's going to be in better alignment, and it's going to put a lot less stress on not only the muscles in your back, but also the discs and the facet joints in your back too. So let's say you're working, let's say you're doing a lot of yard work or something like that, and it starts to get sore. So you want to just stop for a moment. The first line of defense is always to correct your posture. So take a moment and start working on just getting your head more over your shoulders, get your shoulders back a little bit, not way back, just back just a little bit. Get your head over your shoulders and just work in that position for a little bit. And in a few minutes that should change. If not, then you can start working on, again, working shoulder blades back. Again, keep that upper body position better, and then work on retraction, just work on straight back. And that should eventually take care of it. If not, then you go into the next exercise, be it if it's one-sided, then we can work on the rotations going one way, or side bends, depending on what happens to work for you. Yeah, it just, simply, it just takes practice. Just working on changing your posture and things like that. But there's a lot of things that we do are going to be forward. Jane, you had a question?
I do. When we teach our seniors like fit and strong classes, we teach them to look to the left, come back to the middle, look to the right. And sometimes the instructors yell at them because they'll go from left automatically to the right and won't go to the middle. Is there a problem if they do that? Are they going to stretch something if they don't pause?
It's better. Okay, let's just say we're doing rotation of the neck. All right, now I mentioned if you had pain on one side, you'd rotate the other way. But sometimes if you have pain in the middle, that means you want to work both ways. Okay, it's better if you can retract, turn one way, come back, relax, retract, and turn the other way. People are always taking shortcuts. Okay. It's a common thing. So you just kind of have to, you don't want to yell at them, but
right.
Again, like I said, the more people know and understand about how mechanics work, the more they're going to understand and why they're doing an exercise the way they're doing it.
Okay, thank you.
Because what winds up happening is you got people, and let's say they are slouching a little bit, and their head is forward, and they do this. Again, just like extension, if your head is forward, you're not going to get back very far. You're also not going to be able to rotate completely either. So you want to try to get that so they're back, so the spine is straight, and then looking to one side, then come back, relax, and just retract again, and then looking the other way. Yes, it takes a little while, but it's not uncommon to have people take shortcuts. And then the quality of the exercise kind of degrades if they take shortcuts. You just have to stay after them. So, and I know in a group situation, that can be kind of tough. The other thing too, when you're looking, especially if you're looking with older people, more so women than men, they may have, if they've had osteoporosis and they have some deterioration of the vertebrae, specifically in the thoracic spine, to where they're going to have, the dowager's hump there in the back, to where they're like this. That's going to be really difficult to change because those are actually bony changes. That hump comes from the vertebrae because of the osteoporosis. The bodies of the vertebrae actually fracturing and literally wedging down, and then that tilts them forward. Some people will have just bad posture, but just with a little bit of cues or a little bit of assistance, you'd be surprised how straight they can get. Oh, it might not be really comfortable, or they might have a lot of issues with just maintaining that position endurance-wise. But the more they can do it, just sometimes the simplest exercise is just sitting up straight and keeping your head up and just doing that. And you're going to feel the muscles working, just like if you were going for a long walk or anything you'd feel in your legs. It's just getting those muscles in condition so that they can maintain that position. Muscles in your neck and your spine largely are not strength muscles. They're endurance muscles. They're actually very, very small muscles in all along your spine. They're little short little things that really cross over, and they kind of have layers, and they cross over the different the levels of the spine. But they're small muscles. They're not designed for strength. They're designed for endurance, to maintain your position for the long term. Okay. I don't know if that answered your question or not. Hope it did. You can unmute yourself, Jane. I think, or you can type in too. Okay, so, all right. Yeah, again, it's just creating new habits. A lot of people are going, oh, like this, like this. And then their head winds up going forward and they're like this and like this. Just human nature, I guess. But if you want things to work right, you want to try and reposition things better. Anything else? God, we're cruising right along
here. Scott, to Jane's point, I've been in situations like when I was younger. I remember the thing from PE where you'd stretch your neck by looking down and rolling your head to the left and then to the right. Is that beneficial, or is that not once you get older?
I mean, as a rule, it's, I mean, we do have movements. I mean, you flex, bringing your head down, you got rotation side to side, you got side bending, and you got retraction and extension. Okay, as a rule, you should be able to do everything. Okay, but when you have pathology, when you have a problem, there's certain things that you may not want to do until you can get things cleared up. Ideally, let's say, let's say because your head forward, you're going to have a lot of neck problems, so you want to work on returning that. You know, getting it back to where you can keep your head over your shoulder. But it doesn't necessarily mean that you can't go forward. You don't want to keep your head forward. That changes a lot of the mechanics specifically with the discs and with the facet joints. There's another question here. It was about migraines. Okay. Migraines are technically a specific kind of headache. Okay. They have a lot more to do with circulation in the brain or at the base of the brain, really, than it does with just like being a regular headache. So a lot of people think you have a migraine if it's really, really bad. A true migraine, you usually wind up going to have like an aura. You're kind of like a sensory thing where it's like like you feel like there's a field around your head, things like that. It may also, where bright lights are going to bother you, so you may need to wear sunglasses, things like that. But yeah, a migraine is technically a separate kind of headache. Most of the headaches that you wind up getting are usually like cervicogenic. In other words, they're caused by a neck position. And so, like I said, with the coming up over the top and like that. But,
Yeah, I actually do. I get migraines. I used to get them quite often when I was younger, and there were certain triggers. And one of the triggers as an adult for me is when I have pain in my shoulders and neck, it will eventually lead to the migraine where I have the nausea and vomit. You know, the things that come with my normal migraines. And it's very interesting because it's you know, my triggers used to be like certain smells or certain things, but that pain is now leading to migraines, which is interesting.
So, okay, so we get back to depending on head neck position. Remember I showed on the picture the vertebral arteries. Now, I haven't seen all the, I don't know, gosh, I could probably count on one hand of the number of patients that I've seen that have had a neck problem, and when you reposition them, all of a sudden they start getting either they can't, you know, their vision becomes blurred, or they start to maybe, I won't say lose consciousness, but they start to fade off or maybe kind of nod off. Certain situations, because again, that artery goes through all the different vertebrae. If the vertebrae are off enough, you can cause a little bit of a pinch on those arteries, and that can reduce some of the circulation to your brain and give you those kinds of situations. I'm trying to think, it's probably been a couple of years that I saw an individual there. I was working on doing some neck range of motion stretching and things like that, and he said he when I moved him back, he was getting dizzy, and then I moved him forward, and it took the pressure right off. And I mean, I could reproduce it every single time I did it. So he definitely had like some vertebral artery issues there that needed to be dealt with. That could have easily be part of your problem too.
Interesting.
But yeah, again, if you can, the more you can keep your head in the proper position and keep the stress off of, well, you know, vertebral arteries, ligaments, muscles, the less problems that you're going to have. I'm going to talk about a couple other things here. Let's just say a lot of times, again, because when you have a cervicogenic headache, it's usually coming from the top few vertebrae. Now, I've been talking about retraction and extension, and that works. The cervical spine is different than other parts of the spine in that the bottom 2/3 pretty much work just like everything else. But it's those top couple of vertebrae, 1, 2, and 3, that act differently. Okay, and so like if you were to get a headache, sometimes if this doesn't take care of it, just changing your posture, then perhaps if it's being caused by a problem up high, you can do a little nod. I'm going to go sideways so you can see it. And by a little nod, you can just kind of do like this. Very small. And what you're doing is you're opening up, gently stretching those muscles right up below the skull there, and you're opening that up. That takes a lot of repetition, and you don't want nothing like this. That's too far, because you only want to move just the top few vertebrae there. So just a little nod, and that will open up, will relax the muscles, and it'll help to open up those nerve roots as they come off there, and that can help to reduce headaches. That's a quickie exercise that you can do, but it does take a lot of repetitions to do that. So let's see, any other problems or situations that cause head or neck pain? Or a lot of times, again, it's like constant, let's say if your monitor's off to one side and you're constantly, you got your keyboard here and you're constantly looking off to one side, that you're going to shorten one muscle group and you're going to lengthen the other, and then you try to come back and say, oh, it's really stiff and painful. So, I mean, that's for a minor problem. If you did it enough, yeah, you could actually change pressure within the discs and things like that. But okay, sleeping. These things keep just popping into my head here. Sleeping, believe it or not, sleeping is a posture too, and some people have neck problems when they're sleeping. So you can make up just a towel roll. You can take a normal bath towel and make like a snake out of it, and you can place that right on the bottom of your pillow, and just so that the towel roll comes right in here, right against your neck, and fills in that space. That'll help to maintain the natural curve there and take a lot of stress off the muscles and other soft tissue in your neck. Also, if you're a side-light sleeper, you want a pillow that's going to fill in the space so you stay in proper alignment. Right down the midline. Because a pillow that's too small, your head's going to be cocked this way. Pillow that's too big, it's going to be cocked this way. So you want something, find a pillow that's going to fill in that space. If you're on your stomach, that's a tough one, because pretty much you got to be face down, and a lot of times people find that uncomfortable. They have trouble breathing or something like that. There are special pillows that you can make that are kind of like a donut, where your face fits down in them, and then you can still breathe easily. That way you can keep your head, again, straight if you're a stomach sleeper. So there's that one. Anything else? No other questions, thoughts about your neck and things you do or don't want to do with them? Well, we can work down a little bit from the neck. Again, a lot of this stems from posture, whether you're using it because you're working forward and you always got your arms forward. You always want to stretch out the muscles in your chest, your pectoral muscles. You want to get it so your shoulders can go back. And if they're really, really tight here, again, just watch me. Just when you're tight, my head goes forward automatically. You can't keep your head back, and it's really difficult to move. It's just a natural movement. Everything kind of comes forward. So you always want to stretch, your muscles of your chest and your neck and your upper, stretch all that anterior muscles out so you can get your shoulder blades back, so you can have better posture that way. Also, the same thing too is making the muscles between your shoulder blades, instead of being here and just hanging on them, making them actually work to pull your shoulder blades back. So those are additional neck exercises for just your general upper body posture, which will help your neck.
Great. Jane, do you have any more questions? Anybody have anything else?
Oh, that was really good.
Well, thank you.
Very helpful.
So, just in conclusion, if you are having a neck problem, I mean, there's a couple different ways you can deal with it. You can just kind of like live with it. And, you know, what good is that? I mean, you're in misery constantly, and you're not actually getting any better just living with it. Or you can take medications to kind of mask things over, and you know, that's exactly what it does. It masks things over, either muscle relaxants or anti-inflammatories or things like that. Or you can actually, let's say, come to me, and we can actually work on working on your range of motion and doing different treatments to really actually get rid of your problem. So you don't have to rely on, number one, you don't have to live with it. Two, you don't have to take medication all the time to be able to just deal with it. So that's what I do. And
All right. Well, that was wonderful. Thank you so much, Scott.
You're quite welcome. I'm glad that I was invited here to present, and I'm glad hopefully you learned some things. And of course, if you have any questions, you can always give me a call, or 815-344-9727. I should have wrote that down. Someone should put it. But or you can if you go. Oh, that's the other thing too. I do pretty much almost every day on my Facebook page, OrthoGO Physical Therapy. I do like a little video, and I do different things. I've gone through the neck and the back, so you might have to scroll back quite a few little videos and find the things on the neck and back. But you know, yesterday I did one on wheelchairs. And so today I think I'm going to do one on therapeutic ball exercises. I think that's what but I try to do a different little topic every day. I might do it 5 times a week. But you can just go Physical Therapy on Facebook. So I'll have a video there. And you can give me a call if you have questions or concerns or whatever about any of those types of things. Problems you're dealing with, we can help you get better.
Scott, Jane would like you to give the number again.
Oh, I'm sorry. 815-344-9727. I get used to saying it twice, and I just. That's what I should say. Should have a little, like, shines up like on channel 11. Here, call this number. Yeah, 815-344-9727.
All right.
So, you know, you don't, Illinois now it's coming up on 2 years, 3 years, 2 years, I think, that you don't need a prescription for physical therapy, and insurance companies honor that. It's up to me. I mean, yes, I do. I have some restrictions on what I have to follow. You actually have to show improvement in 10 visits. So if you don't, then I'm by law bound to send you back to your doctor. But you don't need one to come in. If a person is on Medicare, I do have to have a signed plan of care. So what I do is I'll do an evaluation. And yeah, for all my spinal evaluations, I allow like an hour and a half. It may not take an hour and a half, but I allow that much time to go through like all the things I just went through, and some specific exercises for them to work on between that and the next visit. But then I write up a plan of care, send it to their doctor. I've never had a doctor fail to not sign it and return it. Because all they really care about is their patient's getting better.
All right.
Yeah.
Well, thanks again, Scott. And we will put this up on our chamber website on the archives page for webinars in the next few days.
Very good.
All right.
Come, Jane. Hope I answered. If you have any other questions, you got my phone number, so you can give me a call.
Thank you so much.
You're welcome.
Okay. Take care.
Yep. Have a good rest of the afternoon, everybody.
You too.
Bye-bye.
Bye.